Urolithiasis, or kidney stones, is a common ailment to present to emergency rooms and sometimes primary care offices. And it is a condition associated with considerable pain, but very little mortality in comparison. Most of these people present in a considerable amount of pain. The pain is along the side, both in front and back, and can extend down into the pelvic area. And most of them also have blood in their urine. So renal colic, hematuria, and a positive plain film X-ray is a typical presentation for 90% of the people who show up with urolithiasis. Some people can have vague abdominal pain that is kind of like some other abdominal inflammation, for example, diverticulitis or appendicitis. And some people will have real acute abdominal pain and flank pain. Nausea and vomiting can be seen. Urinary urgency and frequency and penile and testicular pain are also symptoms that can show up in a presentation. There are other things that present similarly to nephrolithiasis, including renal cell carcinoma, which can also cause blockage or obstruction of the renal system or the ureters. Ectopic pregnancy can have similar pain. Aortic aneurysm rarely can have a similar presentation, as well as appendicitis. These can be different kinds of stones from different sources, different underlying causes, but most of them are made of calcium or partially made of calcium, which means that most of them can also be seen on X-ray, because calcium-based stones are radio-opaque. And some of these others are as well, like struvite stones, like you see in this picture here, is a staghorn calculus that is a struvite stone, most likely from some kind of a UTI. Cystine stones can also be radio-opaque, but uric acid stones are not. The risk factors for these different types of stones are associated with the corresponding stone type. A history of nephrolithiasis, as well as family history, can make one more prone to produce these types of stones. Increased oxalate absorption can increase the production of calcium oxalate stones. And some of the reasons that you do get increased oxalate absorption are, for example, with bariatric surgeries. These people often present with calcium oxalate stones. Some medications like indinavir, acyclovir, sulfadiazine, triamterene, taken for different types of infections. These can cause urine to crystallize and create stones. Hypertension, obesity, and gout all can lead to renal stones. Hypertension can cause an increase in calcium secretion. Gout, increased uric acid secretion. Low fluid intake just makes a higher concentration of the urine and makes the urine more likely to crystallize. And acidic urine can make acidic substances crystallize. And UTIs with infection from urease positive bugs like Proteus and Klebsiella can lead to ammonia formation, which can lead to the formation of struvite stones. The gold standard is for now helical CT for imaging. As we noted earlier, plain films can most often pick up radio-opaque stones. but they will not pick up, for example, uric acid stones. IVP is something we used to use, but it involved exposure to too much radiation. Ultrasound can be helpful, especially in the absence of helical CT or in contraindication. For example, in pregnancy, an ultrasound is usually indicated. And with the CT, it's best not to use contrast, or you don't use contrast, because that will make it so the stones don't show up. They get lost in the contrast. And MRI is not really used except for in situations where there's a contraindication to CT, for example, pregnancy, but a stone cannot be visualized on ultrasound. The biggest parts of treatment for nephrolithiasis is pain management and hydration. These people come in a lot of pain, and that's the most important thing to take care of, especially as most of them are not in any kind of urgent danger. Hydration also helps to dilute the urine, which can, in some cases, lead to the dissolving of stones over time, and the prevention of increased stones. And the most important thing is just to take care of whatever is causing the stones to begin with. There are some cases where you want to get an urgent urologic consult if there's evidence of urosepsis or renal failure, or if the patient is just really sick, then you want to get a urologic consult. These patients should be straining their urine in order to help identify the stones if we don't know what kind of stone it is, and help us to prevent it in the future. And in some cases we do need to facilitate the passage of stones. You can get these stones to pass in a number of different ways if they're not passing all by themselves. Medically, you can give antispasmodics in order to allow the smooth muscle to relax in the ureters to make more room for the stone to pass through. Calcium channel blockers and steroids have a similar effect. There's different types of lithotripsy which break up the stones. Shockwave lithotripsy or uretoscopic lithotripsy. And with uretoscopic lithotripsy, you can use either a laser or hydraulic pulse lithotripsy. And in some cases, rare cases, then you got to go in and get the stone with surgery. Once the stone is taken care of, the main concern for the patient and for you as the doctor treating the patient is to make sure that this doesn't happen again, which usually is going to be figuring out what the underlying cause is and keeping it from happening again. So hypercalcemia, you want to take care of their calcium levels. Hypercalciuria, you can give thiazide diuretics, which prevent the secretion or the secretion of calcium. A low sodium diet does the same thing. If they have hyperuricosuria, then allopurinol can be used. Hypercystinuria, you can alkalize the urine. And with struvite stones, just preventing UTIs in the future is going to be the most important. With all of these, fluid is an important factor to be taken in as much as possible.